Now, could your treatments, your aesthetic treatments, as well as your medication be causing any uneven skin tone or patches on your skin? Now, that could be an excessive pigment, such as hyperpigmentation, or the loss of pigment, such as hypopigmentation. When it comes to pigmentation, there are lots of reasons why pigmentation happens. It could be because it's just natural pigmentation, such as freckles. It could be post-inflammatory pigmentation, such as acne scarring. It could be inflammation, as well as hormonally related pigmentation, such as melasma and other factors that will contribute to it. Or it could be sunspots or age spots that could be due to excessive sun exposure. So there are lots of reasons why pigmentation can happen, but at the same time, having certain treatments can actually induce pigmentation, or it actually increases the risk of loss of pigmentation, and that also can happen when you are taking medication. And this medication doesn't have to be just in the topical form. It could be an oral form that you could be using it for, say, chronic skin or chronic diseases, and as in health diseases. So I wanted to actually go through different types of medication and treatments that could potentially cause an increase in pigment or a loss of pigment. It could be permanent or temporary. So why did I do that anyway? So here's a little bit about me. My name is Balsam, and I am a healthcare professional with over 25 years of healthcare experience, and also being a clinical pharmacist and a prescriber, I have seen and really worked with a number of patients, both in the skin space as well as the general health space. And so from that perspective, I felt it was really, really important to really highlight the different treatments and the different medications that can actually impact on your skin. And more to the point also is I run my own skin clinic, and it feels really, really natural now to make sure that I have a guide just to, as a patient or even a skin enthusiast, or maybe you are the skin specialist and you want to get a little bit more of a broader term of what causes pigmentation from a medical perspective, from medication as well as skin treatments. So here in chapter 1, I go through the different types of drugs and medication that can induce hyperpigmentation, which is an increase in pigment, and some of them that you may be taking on a daily basis because it manages your chronic diseases, and others could be as a one-off. Now when we go to chapter 2 looks at the hypo, which is a loss of pigment, and it goes through all the sorts of medication that can really potentially risk the loss of pigment in your skin. So chapter 4, again, we follow the same theme, so really looking at the treatments themselves, what type of treatments they are, whether they're peels or lasers or other sort of facial treatments, as well as the aftercare that we need to really advise the patient to make sure that they follow and adhere to minimize the risk of either hypo or hyper. So I also laid out some of them in a table format, in a sort of a drug, medication, and the risk factors, and I looked at the actual medication itself that can cause hyperpigmentation, or medication that can cause hypopigmentation. So here you see the same thing, that I've got a table of treatments, and then also what the risk factors are and what we can do to minimize them. And the same thing happens here when we look at some of the treatment, the indication, and also the risk factors that are involved. So this is a really, really comprehensive book that looks at all sorts of treatments, all sorts of medication, and it's a great tool to have just as a reference point for both clinic owners as well as skin enthusiasts. So if you're interested in this e-guide, hit the link below and secure your copy. Keep glowing and stay amazing.